afternoon. My name is Karl Tupper, and I'm a staff scientist for Pesticide Action Network North America. For 25 years now, PANNA has been working to replace toxic pesticides with ecologically sound and socially just alternatives. We do our work with a diverse array of individuals and organizations from our home state of California, from across the country, and from around the world. And I'm here today to talk about two closely related projects that my organization has been involved with here in Minnesota. About a year and a half ago, a group of concerned citizens from this area got in touch with us. They told us that their health and the health of their animals had started to decline soon after industrial farms had taken over the land near their homes. And they suspected that pesticide drift was the cause, or part of the cause. And many of these people are here today and have told you their stories. And I think there are some other people who will be testifying later on today. But anyways, before they came here today, they came to us and asked if we could help them figure out what was going on. And so my organization, PANNA, has developed a simple air sampling device that we call a drift catcher that allows communities to document drift. It's based on the air sampling equipment used by the California Department of Pesticide Regulation, and sampling protocols are based on those developed by the National Institute of Health and National Institute of Occupational Safety and Health. For a few years now, citizens and communities from California to Florida have used drift catchers to shine light on the previously invisible problem of pesticides drifting from fields and into their communities. And so at the request of the concerned citizens here in Minnesota, we provided them with drift catchers and the necessary training and laboratory analysis to allow them to start investigating and seeing what's in their air. And so this past summer, and also the summer before, this group of concerned citizens used drift catchers to collect air samples from sites around Browerville, Staples, and Frazee. And they were very motivated and very diligent, and they collected a lot of samples. And I should say that while they were busy collecting samples, another group, the White Earth Land Recovery Project from the White Earth Reservation to the north of here, also got in touch with us with similar concerns. And they were particularly worried about pesticides drifting over their new elementary school in the Pine Point community. And we also agreed to provide drift catchers and training laboratory analysis to them. And I should say that when we started this project, we didn't really have any idea what we would find, or if we would find anything. We didn't know what pesticides we might see, since in Minnesota there's no right to know what pesticides are being used near your home. So, you can ask the grower, but obviously he's not under any obligation to disclose what he's using. And so we thought we'd probably see a variety of pesticides, different pesticides in different places depending on what the crops are in the area. And we did see several different pesticides, but one thing really stuck out. And that's out of 186 air samples collected by the two groups from 11 sites in northwestern Minnesota. We found the fungicide chlorothalonil in 123 of them. So that's 2/3 of samples. And I have a map here that shows the results, and I believe the committee has copies of this map, and I brought a number of copies, and I'd be happy to share these with anyone who's interested. But anyways, what we find is, 2/3 of the time somebody takes a sample and we analyze it, we find chlorothalonil in those samples. And I should also note that, we think this chlorothalonil is probably coming from legal pesticide applications. There's no evidence that it's being applied in ways inconsistent with the label requirements. So we think that this drift is a problem even when all the rules are followed. And, but so, what does this mean? What is chlorothalonil? Chlorothalonil is a fungicide that's used extensively on potatoes in Minnesota, and it's sold under the trade names Daconil, Bravo, and Echo. And to give you some idea of how extensively it's used, in 2005, 83% of potato acres were treated with it, amounting to about 400,000 pounds. And it's applied preventatively and repeatedly, so a grower might apply it every 5 to 10 days from the time the crop is planted until harvest. And common sense will tell you that if you live next to a field that's being treated that intensely, there's probably a pretty good chance that you're going to get drifted on. And the folks who've been working with us on this project have suspected this for a long time. But they've been told that their common sense was wrong, that pesticides are sprayed in the field and they stay in the field and they don't drift. But what our results show here is that their intuition is exactly right, and that this pesticide and probably many others do drift all over the place. And some people might say, well, there really isn't any risk from breathing chlorothalonil, or if this was a problem, if this was dangerous, then we wouldn't be allowed to use it in the first place. But people who would say this are wrong. For one, first of all, the EPA has a habit of allowing dangerous pesticides to be used in spite of the threat that they pose to people. And I think their recent decision to register methyl iodide over the objection of our nation's top chemists illustrates this point pretty well. But with regard to chlorothalonil specifically, the fact is that EPA's risk assessment is full of holes, and there's plenty of science out there, much of it ignored by the EPA in their risk assessment, that suggests that exposure to chlorothalonil, especially by inhalation, does carry significant risk. First of all, the EPA's own risk assessment, and I'm referring to their registration eligibility decision from 1999, their risk assessment indicates that chlorothalonil is much more acutely toxic when inhaled versus when ingested. And so they put it into acute toxicity category 4, which is essentially non-toxic for oral exposure. But for inhalation exposure, they put it in category 2, which is their second highest toxicity rating. So knowing that it's much more toxic by inhalation exposure than by oral exposure, I think it's very interesting that when they looked at the risk of breathing it, they compared workers' inhalation exposure to safe levels that were derived from oral studies in which they fed animals chlorothalonil in their food. And so they very likely underestimated the risk of breathing this chemical. But as bad as their assessment was, the EPA has at least looked at the risk that breathing chlorothalonil poses to workers. They have yet to do so for people who live near fields where it's applied. In 2005, California Department of Pesticide Regulation issued its risk characterization document for chlorothalonil. That document discussed a number of animal studies, including several that were not mentioned in the EPA's assessment. And remarkably, animals were sickened by chlorothalonil at every dose of every test that's discussed in the California document. So in other words, as of 2005, scientists have yet to identify an inhaled dose of this chemical that does not cause signs of sickness in animals. Chlorothalonil is known to cause cancer in laboratory animals, and the EPA classifies it as a B2 probable human carcinogen. It's also reported to be a sensitizer, meaning that people who come in contact with it repeatedly can develop allergies to it. And these allergic reactions can range from very mild redness, skin rash, redness, dermatitis, to asthma, to in some cases, an anaphylactic shock reaction. And in fact, one death has been attributed to reaction to chlorothalonil. A lieutenant in the Navy died from a reaction to it 1 month after playing golf on a course that had been treated to it the week prior to his game. And the possibility that people living near chlorothalonil-treated fields might develop allergic reactions to it, this has not been considered by the EPA in their risk assessment. And I should also point out that the EPA did not consider what happens to people exposed to chlorothalonil in combination with other pesticides. And so in our studies, at some sites on some days, in addition to chlorothalonil, we also detected chlorpyrifos, PCNB, and pendimethalin. And so nobody really knows what the health effects are of these combined exposures to pesticides. The fact of the matter is simply that we have no idea what the health effects are of long-term inhalation exposure to chlorothalonil, and we have no idea what the safe air level for this compound is. And that's a problem because the evidence that we've collected here shows that people in this area are being exposed to chlorothalonil repeatedly and consistently during the growing season, and presumably year after year. And unfortunately, this shouldn't come as any surprise. What we've documented here is consistent with results of studies of chlorothalonil drift conducted in California and also on Prince Edward Island, where they grow a lot of potatoes. And these results may only represent the tip of the iceberg. Our methods could only detect a fraction of the 1,000+ pesticide active ingredients in use today, and none of the inactive or so-called inert ingredients in the formulations. And so it's entirely possible that pesticides could be drifting out of fields and into people's homes and yards and schools that we just are totally, that we just couldn't have detected. And so to sort of wrap up, I just like to say that the bottom line is that drift is happening, and drift is happening, and it's not just from illegal applications. It's from labels that were done according to all the rules on the label. And the people who we're hearing from today telling us about their health problems, they're not crazy. They have been exposed to pesticides, and they're continuing to be exposed to pesticides. And I don't think we know enough to say whether their problems are caused by the pesticides, but we should seriously consider this possibility and take steps to reduce exposure. And we shouldn't just dismiss their concerns as out of hand, especially in light of these results. And so I think Minnesota needs to put public health first, and I think no state, particularly one like Minnesota with such a strong, where agriculture plays such an important part of the economy and the way of life, I don't think any state, especially one like this, should rely on the EPA to protect its citizens.